Okay, so basically now with this recording, we'll just 2-3 minutes we'll be waiting and then we'll be starting.
Okay.
Dr. Bala, have you joined? Dr. Balakrishna?
Here only, sir. Yeah.
So I just request everybody to put their speaker on the mute so that first we'll be starting with the introduction and then followed by the agenda of the today's talk and followed by the panel discussion. Dr. Subrajit will be joining in 2-3 minutes. So he's just busy, he just messaged me. And Dr. Subhadeep, if he's there. So just give us some 1 or 2 minutes. Please put all your mic in the mute mode. Yeah, Dr. Subrajit, you have joined? So, Dr. Subrajit. Yeah, so Dr. Subrajit.
Hi, good evening, Dr. Badi. Good evening.
Hi, Dr. Subrajit. We are waiting for you actually. So you have joined?
Yes. I am there. Yes.
Oh, so nice. So, hi.
Hello.
How are you doing?
Good. So, how are you?
Yeah, fine. So, can you just upload your slides?
I will. Just give me a minute. I will just pull up my slides.
Sure. Yeah. So, by the time you're uploading your slide, let me introduce all the other panelists, and then we'll be starting the program. So very good evening, and I welcome you all on the behalf of our critical care department, Apollo Hospital, and today's session it will be the 16th Apollo Mumbai Critical Care Network, where we have our eminent speaker, Dr. Subrajit. I think Dr. Subrajit is one of the leading speaker, and is one of the the prolific research fellow, and he has taken a keen interest in this area. So that is why we have invited him. He's from Calcutta Peerless Hospital, and he has a lot of this program to his credit. So once you attend his talk, you will realize whatever his views and whatever it's and it will definitely benefit for the DNB students, I'm sure. Hi, Dr. Subrajit. So I welcome you to this group.
Thank you, Dr. Badi, and I'm really happy and honored to be here amongst all the critical care specialists. Thank you very much for this opportunity, Apollo Group. Thank you once again.
Yeah.
Welcome, Dr. Subrajit.
Thank you.
So I myself, Dr. Gunadhar Padi, the coordinator in chief Apollo Hospital, Navi Mumbai Critical Care Department. with us our eminent panelist today and my co-moderator, Dr. Akhilesh Tandekar. He's from Apollo Hospital, Critical Care Department. Hi, Dr. Akhilesh.
Hi, hello.
Yes. And our other panelist for the talk today is Dr. Niranjan Panigrahi. Dr. Niranjan is Chief Intensivist, leading ECMO specialist, and he is one of the DNB teacher and DNB examiner, Apollo Jubilee Hill Hospital, Health City. Welcome,
Hi,
Dr.
hi,
Niranjan.
hi. Yeah, good evening. Thank you. Thank you.
Yeah. So your recent DNB mock exam was actually very good, and it is actually excellent, wonderfully organized. I really appreciate it, and I all request all the DNBs to join for your program next time.
Thank you. Thank you so much.
Yeah, with your hospital. The second panelist is Dr. Saurabh. So Dr. Saurabh is from Artemis Hospital, and Dr. Saurabh has done a lot of research work, and he has also been a keen researcher in many of the areas of the critical care medicine. He is from Artemis Hospital, consultant intensivist. Welcome, Dr. Saurabh.
Thank you. Thank you so much. Thank you for having me here.
Yeah.
Dr. Saurav has a keen interest in writing papers, articles, journals. If you want to really have appraisal of the paper, we should listen to his lecture. We will be arranging it very soon.
Sure. With us, our other two panelists, Dr. Balkrishna Nimabhat. So he's from HN Hospital, consultant intensivist, HN Hospital, Mumbai. And actually, Dr. Bala has published many books, and he has also published many research articles. And actually, he is one of the very famous articles, how to do a research in critical care. And I would request Dr. Bala to share it with all the DNB students, because it is eye opener for everybody. Welcome, Dr. Bala.
Yeah, good evening, everyone. Thank you.
Hi. Also with us, my co-consultant, Dr. Subhadeep Sen from Apollo Hospital. He is also a DNB teacher and also one of the research coordinator at Apollo Hospital, Navi Mumbai. Welcome, Dr. Subhadeep. And today's
we have one more panelist,
special guest,
Dr. Sastra Buddhe. So Dr. Sastra Buddhe is the coordinator for DNB program at Apollo Hospital, Navi Mumbai. He has been the mentor for the thesis acceptance, thesis writing. He guides everyone how to write the thesis, how to write the protocol, how to do the statistical analysis and all that. So I welcome Dr. Sastra Buddhe. Hello, sir, Dr. Sastra Buddhe. You're there, sir?
And sir is basically instrumental in developing the DNB programs. Under his guidance, actually, we had developed the DNB curriculum and DNB programs, in the particular in the critical care department. So we welcome sir to this panel, and hopefully should throw some insight to other new DNB trainees in this program. Sir, you are there?
Yeah, he said he's joining.
Okay.
We can go ahead.
Okay, so with this, let's start the program without any delay. So Dr. Subrajit, can you load your slides?
Yes, I can load my slide. Yeah.
Yeah, please. And I request everybody to keep their mic in the mute mode, and at the end of this session, we will take questions, and we'll have an interesting panel discussion. Thank you.
Okay, so please let me know if my slides are visible or not.
Not yet.
Yeah, it's visible, but it should be in the slide mode, I guess.
This is in slide mode only.
Slide mode.
Are you not able to see?
Yeah, we are able to see the slides.
Okay, great. So thank you everybody for this opportunity. I work at PLS Hospital in Calcutta, which is a 400-bedded hospital, and we have 10 DNB programs. I'm head of the DNB program at my hospital. And this is some thoughts which I think we can share with the DNB residents here, because whether it is in critical care or it in orthopedic surgery or any other clinical specialty or non-clinical, I think the ethos is very similar when it comes to DNB thesis writing. So again, thank Dr. Padhi for giving me this opportunity for sharing my views. So to begin the presentation, I would say that what is a thesis? A thesis is a written work resulting from original research, especially one submitted for a higher degree in a university. So all the students here, they are preparing for a 3-year degree course or a 2-year degree course post-diploma, and the DNB requires you to do some original research. And this is submitted to the DNB board, because after its acceptance, you give the exam and you can get your degree. So why is it required? Because all the universities, including the DNBs, the DNB requires it, and it is very essential for the PG training candidates that they should be exposed to research. And research is a very important aspect of a physician role, because as physicians, we are all researchers. I mean, think about COVID-19. In 2017, if people would have never thought about that COVID-19 will change the way how critical care specialists were managing a case of acute lung injury. So every day we learn while we are practicing, and this physician role as a researcher is extremely important. And because of this, learning research while you are doing a postgraduate training is extremely essential as well. And this helps you to appraise or utilize new knowledge to improve the clinical decision making in your day-to-day practice. So who selects the topic? The DNB students, sometimes they are in dilemma. So who should select the topic, whether it is a guide or student? I think it should be a consensus decision between the guide and student, because a very important thing for a DNB thesis topic is that it should be interesting to the student, because if it is not interesting to the student will not be able to proceed further. Topics which are selected, what topics should we select? We should not select any outdated work, because you will have to remain in the profession for more than 4 decades. So if there are topics like, which have publications only, where publications are available only for the something was published in last 10 years or 12 years, it is not a good work to go for a DNB thesis. So do something which is interesting, which is relevant, which is going to change the mindset of the clinicians and also add to the medical literature. Your dissertation is also, or a thesis, as a reflection of your hands-on experience. So if you really are in critical care and you want to look at the, say for in TB meningitis space, and you are very interested in looking at how these patients present, do this, take it up, and show your experience to the examiner also, that that this is what I have experienced during my postgraduate training program. Avoid topics which do not give you adequate and modern skills. So this is sometimes, I would say that students just do observational medical records, audit kind of DNB theses. For a person who's doing the DNB in DNB in medicine, or I would say a super specialty in critical care medicine, these are probably not the right topics to pick up. All your studies will require ethics committee approval, because many people believe that retrospective studies don't require ethics committee approval. That is not correct. All studies require ethics committee approval, and a clearance letter from the institutional ethics committee is mandatory for each research proposal involving questionnaire surveys also, because the DNB is now asking students to give the ethics approval letter attached in the thesis. So be very, very careful that you have your scientific committee approval and your ethics committee approval. Questions you must ask when you have chosen a topic is, what is the problem? What is the relevance of this problem? What information is already available? So literature search. Once you define a topic, the very important thing is to do a literature search. Refine your question again by literature search. So you might have thought that maybe COVID-19, somebody was telling me yesterday, I was talking to a critical care specialist, and he wanted to do a study on the echocardiography changes in heart in patients with long COVID syndrome. And I just told them that you first do a literature search and find out if anything is published from the Indian perspective. And he was very confident that there was nothing published. But when we did the literature search together, we found a lot of studies. So what I mean to say is that if it's already done, then it doesn't become relevant. So pick up something relevant, what information is available, do adequate literature search, and also have a very clear-cut mindset on what do you want to achieve at the end of your study. So there should be a hypothesis in your mind. You probably might not write it, but then it should be in the form of an aim, because DNB asks every students to write the aims and objectives of their study. So it should be very clearly mentioned what is the aim of the study, what is the objective of the study. The thesis should include a title page, certificates from on the head of the institutions, your thesis guides with signatures, declaration by the postgraduate student or the postdoctoral student that this is an original work. We should contain the certificate of ethics committees, acknowledgements and contents, especially the Gantt chart. The contents, what are the basic contents of a thesis? We have the introduction, aims and objectives of the study, how the review of literature was performed, the methodology of the review of literature, how the materials and methods were done. We then go to the results, discussion. There has to be a summary page, conclusion. Bibliography is extremely important because the Vancouver style of referencing is what is preferred by the DNB. Because if you don't have a Vancouver style of referencing, I have seen students come back to me saying that the thesis has been sent back by the DNB board. And finally, the annexes. What are these annexes? The annexes are the case report forms or the various data collection forms and the informed consent forms which you have utilized in your study while you were performing the study. So the cover is, you have to write in the cover, it's, I've seen many times, the candidate name has to be with the degree, the name of the guides has to be properly mentioned with the degree, and proper degrees have to be mentioned with their affiliation, and they can be of different colors. I mean, just keep the colors not very jazzy one. Acknowledgement, it is very important to acknowledge people who helped you do your thesis. So sometimes you might do a collaborative work with the Department of Microbiology, or you might do a departmental collaborative work with Department of Radiology, who might not be your co-guide, but has that person might have helped you a lot in collection of your data. So please give acknowledgement. And this is extremely important that, you know, that you must give acknowledgement for the assistance received for laboratory tests, statistical analysis, because your statistician is the one who saves you, and compilation and library searches as well. Sources of funding. Sometimes theses are lucky enough, students are lucky enough to get funding for their theses. So you must also identify the sources of funding, which must be in the acknowledgement section. So the first chapter of the thesis is introduction, which is a general description of the problem, followed by the statement of the specific problem and the motivation of the study. So why did you perform this study? What was available in the literature and what motivated you to go ahead for the study? It is a prelude of your movie, I would say, the movie thesis. So this is the introduction part. What do we write in introduction? We write what is known about the topic. We also write what is not known about the topic. And we also write what we are going to achieve at the end, what we are hoping to achieve at the end of our research. It's a comprehensive and a critical review of the literature, which has to be in the introduction section. And this introduction section is the make or break section, because if you are not able to justify why you are doing this particular study, then the examiners, they get very upset that why if the objectives and aims are not very clear. So the first paragraph in a good introduction should provide a brief background in the present tense to establish the context, relevance, and the nature of the problem. You must give statistics, and when you give statistics, please give a reference. I have seen many theses come back to my hospital because the referencing has not been proper. If a referencing is that the incidence of diabetes in the elderly age group is 60%, then you need to have a proper reference from an authentic book or a journal. The second paragraph of introduction may include importance of the problem and unclear issues, which we mentioned as what is unknown. And the last paragraph clearly states the rationale of the study, the hypothesis, the main objective, and the purpose of the study. I mean, why did you do the study? So this is the example which has been taken from one of my students of our student at PLS Hospital in Kolkata. The example showing from a DNB orthopedic surgery thesis, which has been accepted And look at this introduction. He starts with how the humans have evolved over ages, and then it talks about what are the different aspects of the bones, and then he talks about the humerus fracture, how common is it, and he gives a reference for it, and then what is the prevalence of this, and then he mentions about what he wants to do in this particular study. The review of literature is one very important thing which can make or break your thesis. And I would request Dr. Padi that he can have regular sessions, because today I'm just going to give you a brief gist, or I would say a trailer of the movie thesis, because it is impossible for someone to talk about how to write a thesis in 1 hour, or rather 45 minutes, because we can't speak for a long time. Nobody's going to listen to it. That's very important. So the review of literature, we can have a session on review of literature, because many of the times I've seen the postdoctoral and the postgraduate students, they are not aware on how to do review of literature, because review of literature throws light on what is known about the topic, what we don't know, and what are we trying to identify, and why did we do the study. Review of literature should consist of traditional text where you have experimental research. It should have early publications from books and index journals. Very importantly, recent publications. So if you are submitting your thesis in 2023, make sure that if the submission date is usually around, for people who are giving exams in July, so the submission date is roughly around April. Make sure that you have not missed out for any publication or which has come out in the first 3 months of the year. You should tabulate the most relevant references at the end of the section. And if I am a student who's appearing for the exam, I probably would have the recent most references cited first in my thesis. There are various search engines and websites which can help you do the review of literature. You have the Science Citation Index, you have the annual reviews, you have the PubMed, and you have the Medline, and of course you have the Google Scholar. Apart from that, you have these particular search engines where a literature search can be performed. So when the literature search is performed, you can start in a way where in this particular example, you see the student has started from the oldest or the earliest one. He talks about what happened in 1600 BC, how the management of difacial humerus fracture used to take place. And then as the days went by, how modern medicine and orthopedic surgery has evolved and has taken care of the fracture, the difacial humeral fracture. The take-home message for this particular slide is that you must maintain a pattern. It should not be that, you start with the prehistoric age and then you go to 1950s, then you again come back to 2000 and you go back to prehistoric age again. If you don't follow a pattern, it is not going to be palatable to the examiners. Research objective. Now, very, very, very important. Let me tell the students and the doctors who are attending here, who are going to appear for the exams, every study should have only one primary objectives. I have seen multiple students come to me who have 3-4 objectives and they have not clearly defined which is primary, which is secondary. Please remember that your study will stand or fail on the basis of the statistical analysis of the primary objective. If your primary objective of the study is met, then your study is successful. If it is not met, then it is unsuccessful. You cannot have multiple objectives as primary objectives, because hypothetically speaking, if you have 3 primary objectives, if the study is successful in achieving 2 objectives and does not achieve the 3rd objective, what is your interpretation? The examiner, while you are appearing for your Viva OC, is going to ask you, do you consider this as a successful study or non-successful study? You probably will not have the answer. And let me tell you that the sample size, another very important determining factor, is to be calculated on the basis of primary objective. So here, if you see, the student has clearly defined the primary objective and he has multiple secondary objectives. So secondary objectives can be multiple, but the aim is also very clear and it has to be clearly mentioned. Now, materials and methods section, it provides detailed methodology used to conduct the study. It should provide sufficient details, but it's not expected to be written like a laboratory manual. We should describe what control was used, and it is highly critical. The critical steps have to be mentioned in aims and in materials and methods. So the few areas which have to be covered in materials and methods are study area, study period, sample size, study population, sample design, patient selection, inclusion, exclusion criteria, because all of you have to define your inclusion, exclusion criteria to make it as focused as possible. If your inclusion, exclusion criteria is not well defined, let me tell you students, this is not going to be accepted as a very focused thesis, and sometimes the theses can come back and they come back really very short of your final exams. Results have to be very concise. They should include what you found. There is no point in giving multiple tables and multiple charts. It should mention the level of significance. If you're using a table, it should include the level of significance. Graphs and tables should be used complementary to each other. You should not use graphs and tables together, and they should not be duplicate of each other. Tables should be numbered, and they must be numbered in Arabic numericals. The table should have a comprehensive heading. Many times I have seen students just give the table, they refer the table in the discussion part, but they don't have any numbering or they don't have any heading. It is going to be problematic in that case. Each table should include the P significant if you have found a P significant in asterisk, and the level of significance should be mentioned below the table and should be in bold. So this is, if you really see that they have mentioned, this is the table which this student has mentioned, the frequency table, the percentage, and then the level of significance, what he found as to be significant in the age population of his patient, he has clearly defined in his tables. Figures should not duplicate the data in tables. Figures should be numbered. Figures should have a legend. Every figure should have a legend below the figure, and the units should be provided in the SI system. After you've given the figures, we come to the very important section, which is the discussion section. If you look at the discussion section, it is a very, very important section. And I'll tell you, sometimes I get theses, I get MD theses for reviewing and approval from the West Bengal University of Health Sciences. The first section I look up is discussion, and the next one is results. Because while reading the discussion, you can understand whether the student has done the relevant review of literature or not. While reading the discussion, you can understand whether he has understood what he has to do, because it's results. If the discussion is repetition of results, then it is not a discussion. Discussion has to mention the findings which are similar to previously published studies. Discussion also has to mention the startling differences with previously published studies, and also you have to mention the differences, why you think the differences came. The discussion section should also mention the weakness and strength of the study. Many people believe that there is no strength of their study. This is not correct. Even a unicentric study done for the first time in the state of Maharashtra, that is a very big strength of the study. If no other state in India has done it, so that is a very big strength of the study. So again, an example from the discussion, and if you see that this is a beautiful discussion which is written, and they have compared it, the student has compared it with all the previous studies and the number of patients who were included, the mean age of these patients with his study. So it gives the examiner a clear-cut evidence that yes, the student knows on how to write the discussion and what the discussion should involve. After the discussion, you have the summary section, which should be the standalone section. If anyone would like to know what you did in the study, the people should read the summary section. But let me tell you, the summary section should not be the results repeated, because in summary section, you should include the background of within the very salient 1 or 2 lines of background, the aims, the methods, the results, the implication, drawbacks, and directions for future research. Now, every study should end with some kind of direction with future research, or at least a line that if you're done a unicentric study, we say a multicentric study. If it's a multicentric study, we want to do a multinational study, something like this. So this is the summary page, and it is a single page. It has very clearly and very nicely picked up what are the major salient features of this study and what was found by the student while he did his DNB orthopedic thesis, orthopedic surgery thesis. Conclusion is a very important part. Again, These should be brief, generalized statement to answer in general the specific objective of your study. It should also include the propensity if you can generalize this particular inference to the population. And if they cannot be generalized, that also needs to be really mentioned. Flexibility is considered in making for conclusion. It should not state conclusions on a one-to-one correspondence with the problem. So you should not give a very sweeping statement saying that with the help of your 50 sample study, you believe that this can change how a management of a patient is being done. So here, if you see the conclusion, I read from and I quote that with correct anatomical knowledge, pre-operative planning, good surgical techniques, and post-operative rehabilitation, antegrade interlocking humerus nailing is a viable option for the management of fracture shaft humerus, promising excellent outcome. We hope that in days to come, through continued medical research, further refinement in nail designs and surgical techniques is possible, offering mankind a better quality life. So please leave with a positive, end with a positive note that yes, this is what we want to conclude and we need to do more medical research. Another very important annexure is the Gantt chart. It is a chart in which the series of horizontal lines shows the amount of work which was done during certain period of time when the thesis was being conducted. So this is the total raw data chart. Please give the Gantt chart in your thesis. This is one of the most important annexures which must go with your thesis. If you don't put the Gantt chart in, then many of the times I've seen students coming back telling me that the DNB board has returned back their Gantt chart. So this is a rough time management timeline. I tell my students, draft proposal around 3 months and you have to submit it to the DNB. Quarterly progress report at least to your mentors 6 months. Preliminary protocol with Gantt chart every 3 months. Final draft dissertation should be 7 months before the exam. And final dissertation, we all know, or thesis should be 6 months. DNB wants you to submit 6 months before the exam. Bibliography is another very neglected section. People just copy paste and they copy paste in a wrong way. We must ensure that the list of sources which are used to get information is included in the end of report. Please include it in the sequence in which the information appears in your text. It should be in the Vancouver style of referencing because that is what is recommended by the DNB board. The preliminary draft of bibliography by listing all sources on a separate paper, full title, author, place of publication, publisher, especially for books, and date of publication for each source. So this is how this student submitted his bibliography. And if you look at the number 6 example, this is a book. He has taken it from the Churchill Livingston book in orthopedic surgery, which has been published in Edinburgh, London, and New York in 1974. So an ideal thesis should be a sound stuff. It should be well written. It should be well presented, and definitely it should be accurate and complete. So what are the theses reviewers looking for? And this I have put together with the help of the examiners who are at my hospital. They are looking at your review of literature. Is the literature relevant? So if you have not included any literature for the last 1 year, be careful, your thesis might just come back. Is the review critical or just descriptive? So many a times people will just say that Dr. Bhaumik et al. Just conducted this study, but what was the critical appraisal? If you have not done your critical appraisal of review of literature, then it is not going to be acceptable. Is it comprehensive? Review of literature should not be more than 5 to 6 pages. I have seen students who have written 20, 30, 40 pages of review of literature. That is not acceptable. Does it link to the methodology and the thesis, and does it summarize the essential aspects? For methodology, they are also looking at methodology because is there a clear hypothesis? Are there any precautions taken for bias? Have you done randomization or not? Were your limitations identified in the methodology? Where the data was collected appropriately, and was the methodology justified? So it is very essential that you need to justify if you do a retrospective study, why you want to do a retrospective study. If you did a prospective study and a sample size was found to be 30, then why a sample size of 30 was calculated. Presentation of results is extremely important because they look at hypothesis has been tested or not, data has been properly analyzed or not, whether the results support the hypothesis, whether results are clearly presented or not, and what are the patterns identified and summarized. Discussion and conclusion, I've already mentioned that the limitations have to be identified, the strengths have to be mentioned, their links to the literature has to be done. Is there a theoretical development, that is you are projecting something in the future, and whether the speculation, if you are saying that something is not happening in your patient, are these speculations well grounded? So to summarize my presentation today, I would say DNB thesis writing is an art and it requires a plan of action. Selection of an interesting topic is very important for the student, and working on the review of literature is the first step or the initial step. Study synopsis must be approved by the scientific committee and eventually by the institutional ethics committee before the student should begin thesis work. Objectives must be clear, and ladies and gentlemen, there has to be only one primary objective and results should be documented properly. Discussions must specify the strengths and weakness of research. This is one of the commonest mistakes which the students do. They don't talk about the strength and weakness. Summary page is a snapshot of your work. Develop it properly, and conclusion must be clear and it must specify future direction of work. So definitely, if you develop your thesis, you in this way you will be able to defend the thesis in a very, very positive way, and you are going to be confident when you see your examiner. With this, I would like to end my presentation. Thank you very much for this opportunity. If there are questions, we'll be happy to take the questions.
Yeah, thank you. Thank you, Dr. Subhrajit. I think in a very lucid manner, you have summarized everything. But actually, it's a vast topic. Actually, the research work needs expertise, and it's actually should be performed under the guidance of a proper mentor. So mentorship program is very, very important. So today we have our eminent mentor with us, Dr. Sahasrabudhe. So, sir, can you just give some of the take-home message to our students today for the DNB who are appearing for the DNB this thing exam, so that Sahasrabudhe, sir.
Hello.
Yeah, sir. Sir, I think you are on mute mode, Dr. Sahasrabudhe. Okay, so by the time, so I really thanks Dr. Subhrajit Bhomik. So actually you have finished very early. So but our students actually like to hear more and more from you. So so Subhrajit, I would request you to remain conduct the sessions for our students. So it will be an eye opener for everybody.
Definitely, sir. And if there are any questions, students can ask any question if they want. I see Dr. Saurav there. Hello, Dr. Saurav. Very nice to see you. How are you?
Hi, fine, thank you.
After a long time, I'm seeing you. So nice to see you, sir. Nice to see you.
There is a nice talk. Yeah.
Thank you, sir. Thank you. If there are anybody has any question, I'm happy to answer it.
So let's hear from Dr. Sahasrabudhe first.
Sir, Dr. Sahasrabudhe, sir. I hope you're there. Hello. Can I request Dr. Sahasrabudhe to give some insights?
I think he's automatically muted. Can somebody, the admin can unmute Dr. Sahasrabudhe, sir? So there is one question from Dr. Madhuri. So basically, sir, what apps are those? Midline and PubMed, and one more. What is you have described to Dr. Subhrajit?
Yeah, Dr. Madhuri, I think, review of literature is very important. So it is not an app, I would say. These are search engines. So if you look at the, your review of literature has become very easy now. 20, 30 years back, people used to go to library, bring out journal. So you have to go to the PubMed. PubMed is one search engine, and this search engine is maintained by the National Institute of Health. But there are multiple search engines apart from PubMed. So another one is Google Scholar, where you can search. Medline is another search engine. If you go to Medline, you will be able to find a lot of articles on Medline also. So
Are you able to hear me, sir?
Yes, sir. Yes, sir.
Yes, sir. Yes, sir.
Yes, yes, we can
Are
hear
you able to hear me?
Yes, sir. Yes, sir.
Yes, yes.
Um, First, I must congratulate Subrajyoti for giving a nice presentation.
Thank you, sir. Thank you.
Very nicely, out of your total experience, what is required from the DNB students and what is expected at the DNB level. Here, through your slide, I think you are describing in detail. I will add some points only. As far as the national board is concerned and students, mainly the thesis work is applied research, because the original work, it takes time, and secondary students have only 10 or 12 months and primary students, they have got about 20 months. So original work is not expected by the national board, but only the applied aspect and the clinical research. That is one point. Then selection of topic, out of my experience, what happens, the postgraduate students and guides, there is less interaction, and when they select the topic, they do not have the workload in the hospital. So size of the sample is very difficult. What I have found that after 6-7 months, the students come and say that they were not able to get adequate cases. So while selecting topic, I think the consideration has to be given for what kind of workload and OPD, IPD patients, whether they are able to get that much size of the sample during a stipulated period. That is one suggestion. And review of literature, what I have found that the students have cut and paste policy. In review of literature, they do not do the review of literature properly. And actually, I make them work and tell them during the induction lecture that review of literature is, it has to be a continuous one, not discrete. So continuous work, how the knowledge has grown over a period of time and how many authors have added other different aspects and other things. So that review of literature, and sometimes review of literature, as you said, they put 20-30 pages. So actually, as per the national board, the review of literature should not be more than 4 to 5 pages. They go on putting the anatomy, applied aspects, physiology, and all. That is not review of literature. So review of literature should not reflect theory aspect at all. Work done and how the knowledge has grown over a period of time. That is what is required. And in thesis protocol, they have to give gaps in the literature. So that is to be mentioned specifically. And what is the research question? That research question also has to be put in proper way. Then objectives, as you rightly said, the students put 4-5 objectives, and whatever in thesis, whatever objectives they are putting, through methodology, how they have fulfilled, that has to be reflected. So there is no point in putting the objectives, as you rightly said, 4-5 objectives. And if they are not fulfilled in the methodology and results and discussion, so that comparison has to be done properly. And as you rightly said, the objectives should be, as I always tell, that the objectives are SMART. S means specific, M means measurable, A means achievable, and R means replicable, and T means time bound. So that is SMART. Objectives should be SMART. And national board, some of the thesis which I have seen, the national board encourages references only, not bibliography, because the bibliography means all the references you may not use. But as far as the thesis is concerned, national board, because in some of the students, that objection was raised that why you have put bibliography, but it should be references, and all references should be reflected in a chronological order in the entire text. That is very important.
So
And in methods, material side methods also, the measurement of objectives should be quantified. They may use either pay score or scales or whatever. So that has to be included properly. And in discussion also, sometimes what happens, they discuss discussions should start right from first table, and it should go over a period of time. Discussion must be interpreted in terms of tables. So in table number 1, then discussion, table number 2, discussion. So it should be in continuous flow. That is what I have suggestions, all these, I think. Otherwise, but we are nicely covered. Congratulations to you. Over.
sir, there is a question from Dr. Aga. Should there be a lower limit to review of literature and as in the least number of words that should be recommended for an research thesis?
Least for review of literature?
Lower limit to the review of literature. Is there any lower limit? The higher limit you said it should not be more than 5 to 6 this thing pages.
4 to 5 pages. Review of literature should be adequate. It should start right, how related to the topic, how the work was started, and over a period of time, how the knowledge has been added, how gray areas have been identified, and what new things have been added in the literature. And latest references also should be included. So it should be 4 to 5 pages. It should not be less. 1 or 2 pages review of literature is inadequate. It should be updated. Latest references also should be taken into account related to the topic. Over.
Thank you, sir.
Okay.
So there are situations and we go on states also, like
Akhilesh, your voice is
what would
breaking.
be the
actually.
base,
Your voice is breaking.
yeah, am I audible now? Am I audible?
Yes.
Yeah, sir, this question is to the panelist and the speaker as well. So there are situations where we find it very difficult to find the topic, and we keep on searching through different webmates, and we really are confused. Dr. Big has already suggested that the topic should be such that it is relevant to the recent dates that we are having, and it should be able to justify the needs of the question that we are asking. So what will be the best way to identify a topic? Because there are n number of replications. What will be the best?
Question is for.
Can I answer, sir, this question?
Please.
The selection of topic is very important. Now, selection, there are different factors which are to be taken into consideration when selecting topic. Selection of topic should be based on the following criteria. Number 1 is the review of literature, identifying gaps. Now, selection of topic is based on the identifying gaps in the literature. Now, before the topic is selected, DNB student and PG guide interaction and communication is very, very important. I have experienced that there is a gap in the selection of the topic because the consultant, he has interest in some topic and he gives that topic to student. No, that is not the correct practice. So selection of topic, there has to be long interaction between the PG guide and the student. Now, in interaction, the consultant should take into consideration whether this particular topic we are able to complete within 10 to 12 months for secondary students and 20 months for primary students. Whether adequate workload through OPD or IPD it is there or not. If the workload is not adequate, then there is no point in selecting the topic. So that is very important. Workload assessment is very important. So consultant has to take into account all these factors and then interact with the PG guide and then tell PG guide to do review of literature. Because review of literature is done hurriedly and some topic is given, then the students come after 6-7 months, or the topic we want to change. Now, this kind of practice is to be discouraged. So unless the PG guide and student interact and select the topic, normally what I do when I go to Apollo Hospital since 2019 and 2005 at Jahangir Hospitals, I must have, I think, scrutinized about more than 400 DNB theses. And up till now, no thesis has been rejected at the national board. What I actually do, I interact with the consultant and PG guide and ask them to select 4-5 topics. And then out of that, which particular topic is applicable to the existing hospital setup workload. That critical analysis has to be done and then the topic is finalized. Then the students start taking review of literature and other things. So that first important step is very, very important, sir.
I think this is the most important thing, to find a good topic, because after all, like doing thesis is a 10 years job. It will take 1 year and so. But at the end, if the thesis is not published, then your all work is just gone in vain. So you have to find a good topic. So and I think you cannot give responsibility to a new candidate, to a new student to find a topic. It's a main responsibility of the guide to find a new topic for a good topic that is also feasible in his setting is his primary responsibility. Even and it's most difficult job. How I doing this, like for my students who is trying to do thesis in critical care, I am trying to see, like, review all the major journals in critical care, like intensive care medicine, critical care, journal of critical care, journal of intensive care, American journal of respiratory care and medicine. Then also I am trying to search WHO WHO clinical trial history to find if there is any relevant topic, or is that topic can be little changed and can be done in my setting. So the topic choice is very important. I think it is mainly responsibility of the guide to find a good topic and also discuss with the student whether he will be interested or not.
Yeah, just to add to what discussion is happening, I would say we should remember this demonic finer. It should be feasible. The most important thing is feasible. As Sir Shashubudde sir is saying that, time is a major limiting factor. We should not go into such topics which require long follow-ups. This is something, then the patients might not be followed up. This is something which is of major concern. I should be interesting, N should be novel. At least some portion of it should be novel. Something which is done in Apollo Delhi should not be copied in Apollo Mumbai or vice versa. That is not a thesis which is acceptable, I would say. E should be ethical. Anything which is unethical should never be done. I mean, ensure that you have ethical. And R is relevant. It should be relevant to your practice of specialty where you are practicing. So if you have this finer thing in your mind, you can pick up a very good thesis. As Saurav sir is also saying, that a great responsibility lies with the thesis guide, because the people who are coming to do theses for the first time, they are novel people. They are first time undergraduate. We are not having a lot of experience of how to do research. So if we keep this in mind, we will be able to select a good topic and definitely clear our DNB theses and exam.
Dr. Niranjan, Dr. Subhadip.
Yeah, I fully agree with Dr. Vomik and Dr. Saurabh. Now, the students, they are completely new to the system. So now any specialty, maybe orthopedics, maybe critical care or gynecology. Now, how can we expect the student, a fresh first year student, to know the research gap in our specialty. That's a difficult job. Now, there lies the huge responsibility of the guide basically to show the path. Okay, now these are some of the areas available. So go and search and come with the review literature. That is the first step that should be done. And so many methods, so many points to be noted in selecting the topic that is the most important. That is the make or the break point, as mentioned by Dr. Subrajit. Second thing is the protocol writing. So probably we always tell our students, once a proper protocol written means probably 70 to 80% of the thesis is done there. Now they have to go to the literature. They have to go to the sample size, and unlike research, a researcher do. Now students, they have the limited time. Now they cannot devote the whole 3 years or 2 years of time for a thesis. They have time limitations. They have financial limitations. So they can't do something. So a topic should be selected wisely, where the sample size should be adequate. And many times we have seen the tenure is over, and people, they don't get the sample, and till end they keep on struggling. Now we are getting not cases, we are not getting cases. So that's a common problem we see in every specialty. So there again lies the role of the guide to give a proper topic. Obviously, it should be scientifically valid, ethically acceptable, and all these parameters should be there. But protocol writing and case and the topic selection is the most important step in thesis writing.
So, Dr. Subhadeep, what is your view, like observational study versus interventional study? So I think most of the times you practice observational study because of the many problems. So what do you say?
Yeah, that's a very good question. Thank you for asking that question. I think we are here to learn research. We are not here to look at the quality of research, basically. So whether it is observational study or interventional study, the methodology should be proper. Please remember this. If it is not proper, then the DNB will raise a question. DNB is not looking at whether you have been able to do some discovery which will give you a Nobel Prize. No, we are not here to do that. So I would say that if you do an observational study, please clearly define your observational outcomes. Please clearly define the direction of the study, whether it is forward-looking, backward-looking. Sometimes I have seen observational studies where they are saying that I will look behind and then I will follow them up in the front. So that kind of a mixed khichdi study design does not exist. I mean, just be clear on your objectives, on your study design. For interventional study, let me tell you that interventional studies, if you are doing clinical trials, students, I must tell you that you must register it with the Clinical Trial Registry of India, which is ctri.nic.in. If it is an academic clinical trial, as per the latest New Drugs Act in 2019, the letter should go to the DCGI's office that a new academic clinical trial is being conducted in Apollo, Mumbai for a new indication or a new dosage. And please let us know if you have any objection. The new guidelines are clearly mentioning that within 30 working days, if no letter comes from the DCGI's office, that means they don't have any objection. So you must have to clearly keep these things, because this is a law now. If you start an academic interventional clinical trial, please remember that the principal investigator in many cases, which is this novice first year student, has a lot of legal responsibility. What kind of legal responsibility? Suppose this is an antibiotic, 2 antibiotic comparative study. One new antibiotic has come to India, which is relatively new with not much of data. While giving that antibiotic, patient has Stevens-Johnson syndrome. Who is going to pay for the treatment? In a hospital like Apollo, which is very, very expensive, you will have to define this beforehand. And if I'm sure you have great ethics committees, so the ethics committees actually are not road blockers or showstoppers. They will tell you that you have to clearly define in interventional studies what will happen to medical management. And if there is a death, then who is going to take care? This thing, clarity has to be there. So I would say that whatever study you take, ensure that it is scientifically correct, ethically correct. Get it rooted through your thesis guide, get it rooted to the scientific committee, ethics committee, answer their questions. If they give you suggestions, please accept those suggestions.
Sir, can I add something, sir?
Please, sir.
Yes, please.
As an epidemiologist, study design of study is very important aspect in thesis. Now, as far as the DNB students are concerned, clinical trials are out of question, because as per the DCGI, clinical trials are to be undertaken by the principal investigator. DNB student being principal investigator, legally also he cannot take clinical trial. We cannot give clinical trial to him, because if it is a new drug and principal investigator has to be qualified. So students, we do not give clinical trial. Clinical trials are out of question as far as the thesis is concerned. Number one. Number two is there are 4 types of design of study which students can undertake. As it pointed out, observational study. Second is cross-sectional study. That means at one point of time, you take particular, say, pregnant woman with some complications and follow the perinatal and maternal outcome. So that is cross-sectional study. And interventional study, if any intervention is to be done. And fourth type of study is comparative study between 2 operative methods. So these are the 4 types of studies as far as the study design is concerned, which are applicable for DNB students. No clinical trials. And as per the DNB requirements, retrospective study, some portion retrospective study also you can take, retrospective and prospective studies. These are all interventional studies, comparative or prospective studies. So retrospective study to some extent it is also allowed. Thank you.
Yeah, just what sir is saying, just to add, retrospective studies are always allowed, always. So when we talk about a clinical trial, because I'm talking to clinicians here, let me tell you, so doxycycline, which is used in the treatment of all atypical pneumonia, but if you are trying to use doxycycline in COVID-19, which is not as per the label, becomes a new drug here, as per definition. So you have to be very careful. Many times people think that, array, this antibiotic, I will just say the name of doxycycline, it is being used in the treatment of, say, tuberculosis, just hypothetically speaking. So people say this is not a new drug, but this is a new drug because a new indication is being tested. So it is better for DNB students not to get into these complicated studies. Retrospective studies are good, provided you have adequate data, you have access to data. Prospective studies, as I mentioned, you can do observational prospective studies. That means in ICU, one group receiving low molecular weight heparin, other group not receiving low molecular weight heparin in COVID-19. What is the outcome? That is a very good example of an interventional observational studies where you are interventioning, because you don't require a DCGI approval for this. We know that these low molecular weight heparin has been included in the central government guidelines for the treatment of moderate to severe COVID-19. So be careful on, don't embark on the journey of clinical trials as of now, but many a times unknowingly we embark on the journey, considering that we are dealing with quote unquote old drug, but old drug trusted for new indication, new dosage. So if doxycycline was given 100 milligram, OD is now automatically changed to 100 milligram thrice daily. That is also a clinical trial. Please remember this. So a new indication, a new dose, a new formulation, all of them will identify or qualify as a clinical trial. So be just be aware that not to undertake such studies as DNB thesis.
How do we select the sample size? There has been a lot of debate on this as well. And while I was also selecting the sample size for my student, and we had a lot of discussion, and we were also confused. And then we took the help of the statistician and all that. So I would like to have a best answer for this as far as sample
actually
size.
I just try to answer this question. Sample size is mostly needed for the interventional study. First, why do you need sample size? Because we cannot have a large sample size because a trial has potential harm. So, but we need that much of sample size to have less error, alpha error and beta error. And again, like sample size, it depends upon the what is the type of trial. It is a superior trial, it is an inferior trial, or it is an equivalence trial. Then we need mainly four things. One is alpha error, one is beta, 1 minus beta or power. One is we need clinical difference. How much difference we want to we're looking for. Suppose the mortality is reduced by using drug A compared to drug B is 10%. And that is a clinical significance that we are looking for, and it is decided by the clinician. And lastly, we need standard of deviation. Then also we have to add more sample if we're anticipating any loss in the follow-up. Suppose there may be 10% cases will may be lost in the follow-up, so we can add that. This is the main. This is a more like this is a commonly used technique to for sample size. And as Dr. Subhajit says, this is a primary outcome. Sample size is primary outcome is the outcome on the basis of what sample size is calculated. There may be many outcomes. Other outcomes are secondary outcomes. Only the outcomes that influence the sample size is the primary outcome.
Dr. Balkrishna.
Can I add something, sir, on the sample size?
Yeah.
Can I add something on?
Yeah, please add, sir, and please answer this question as well. I mean, it is generally always found that we select a sample size of 30. Does this 30 number has some meaning?
No,
how it is derived?
No. That's why. Like,
I would like to have some rationalization.
Sample size,
because as we go on having higher number, higher the sample size, better will be the results, and the study, the power and everything will improve.
Sample size
30 is only included in the sample size.
That's why. Sample size is a balance between the reduced error and the less harm. In case your study cause some harm to a patient, so it cannot include large, it cannot cause harm to lots of patient. You just have the adequate sample size to have less alpha error and have adequate power. Alpha error and beta error. That is the purpose of having sample size. It's a balance between reduced error and less harm.
Can I say something, sir, on this?
Please.
Yeah. Can I add something, sir?
Yes, sir, please.
Sir, I'll just interrupt here. Basically, Dr. Subhajit has some online consultation, so he has to leave. We really appreciate and we thanks to him to present the talk in this forum, and we'll definitely like to have him here more and more times. Thank you, Dr. Subhajit.
Thank you, Dr. Badi. Thank you, everyone.
Thank you, Dr.
Great experience. Thank you very much. All the best. Thank you.
Sure. Hope to see you again.
Yes, thank you. Bye.
Sure. Thank you.
Yes, Sasrabudhe sir.
Yes,
sir,
sir.
you can say.
Practical solution I will give. What I do, there is a thumb rule as far as the size of the sample is concerned. The prevalence or incidence of a particular disease, if it is more, then the sample size is small. If the prevalence or incidence of a disease is small, in terms of percentage, the sample size is large. What I do, I tell the students, in review of literature, you take out one particular reference related to your topic and send 2 references to the statistician, and statistician will calculate based on the level of power and alpha, and there is a formula for calculating size of the sample. So statistician gives the sample size. This is the best practical way of getting sample size from the statistician. But we have to feed him 2 references, latest references of the related topic. Once we give it to him, he will calculate the size of the sample and put that particular screenshot, and that is to be put in thesis.
Yeah, Dr. Balkrishna, you are there. Dr. Subhadeep Sen and Dr. Balkrishna.
Yes, sir, listening. Yeah.
So can we have your opinion? I think Bala has already written one of the good paper on this?
Sir, basically, I written a paper on how to appraise the article. So I think that topic is quite different than how to make a selection of topic, thesis, and sample size. But I think most of the things are get covered by the experts. So I think nothing left from my side, sir. I think everything is covered by the presenter.
So one question is from Dr. Silpa. Sir, she wanted to ask if it is a pandemic situation, so how to conduct a this thing? Means what is your opinion to conduct a trial in case of pandemic situation?
Pandemic situation, now there is no pandemic. All as far as the COVID is concerned, it is giving the trend of endemicity. So epidemicity, from epidemic point of view, although the cases are increasing, it is the graph showing that it is going toward the endemicity of a disease.
Hello, Gunanda, I'm leaving.
Yes. So I think with no more questions, I think let's conclude the session. So it's really a very wonderful session. I'll really thanks every panelist, speaker, and co-moderator to be present here. Particularly thanks to Dr. Sasrabudhe sir for enlightening us. And this, I'd like to conclude the sessions. Any conclusion remark from anybody? Otherwise, we'll be concluding the today's session. Thank you.
My just advice for the student is that this thesis is a stepping stone. It will learn. This will teach you how to do research in future. So just be curious, just to know the basic of research protocol. Just ask yourself what is clinical questions, what is hypothesis, what is null hypothesis, etc. What is randomization, etc. So just try to clarify all these things while doing thesis, and it will definitely help you in the future.
Yeah. Thank you.
Thank you so much. Bye bye.
Thank you.
Thank you, Dr. Gunnar, Dr. Akhilesh.
Thank you.
Thank you so much. Thank you.
Thank you,
so
sir.
much. Thank you. Bye.
Any take-home message from you, sir? Sasrabudhe sir?
Yeah. I think we have covered, it was a good session, and I think it will definitely act as a guideline for all new trainees.
Yes, sir. Thank you, sir.
And normally, sir, what I do when the new students join for our Apollo, also when the first batch joined, I had taken induction lecture on how to write thesis. So I used to cover all these points in the induction lecture, because the MBBS students, they have no idea about research. So they are a little bit confused that immediately what topic is to be taken and other things. So the practice of having induction lecture for 2 hours with all examples and other things, that definitely helps and stimulate their thinking process.
Yes, sir. Thank you, sir.
Thank you, sir.
So with this, we will conclude the session. Thank you all the panelists and all the audience for making this program a great success. Hopefully we will have more such sessions on the thesis writing as well, like statistical analysis, how to apply statistical analysis, and appraisal of paper. So these are the topics that we are thinking about in near future. For this topic, we will conclude the session, and I would say goodbye and thanks to all of you. Thank you very much.
Thank you.
Thank you. Thank you.